Taylor is a neuro-oncologist here at UCSF. She's a member of our caregiver program team, and she's going to get things started for you just by kind of laying the land on how the tumor impacts the patient, and then we'll talk about how that impacts you.
Thank you, Margareta and Dr. Chang and everyone for organizing this day. It's really incredible for you all to be here, and I have learned in this career so far that taking care of the caregiver is so important to taking care of the patient, that it really is all very integrated. So the talk I'm going to be giving today is a little bit of anatomy, just kind of, we all learn a little bit about the brain in school, but I wanted to just try to take the lens of the neuroanatomy and put it into the context of what you may be experiencing with your loved one, and how, of course, that impacts you, and some of the things that may be able to equip you first with some preparation. So, as has already been stated, and I think this is a nice representation because it doesn't necessarily put the patient in like the middle, like a target necessarily. That really, when we have the patient, it's the family members that are also involved, often a spouse, maybe children or parents. I know that all of those caregivers are represented here today: friends, spouses, children, parents, and that's one of the things about this tumor that's hard, is it really can affect people at all kinds of different ages and at different points in their journey. And so the caregivers who help provide care for them are also in their different stages in their lives as well. So of course, outside of that, there's a larger family unit, and again, the more I do this, the more I realize there's such a huge network, and your job as a caregiver not only is to come to the appointments, or not your job, but you come to the appointments and help care for your loved one, but you have to disseminate all of this information to everyone else, to not only family, but also to the community, people that your loved one may work with, or just sort of you through social media, or just keeping a lot of people up to date. And I think that puts a lot of responsibility on people. So the experience of all of the patients affects everyone around them. So it's you, but it's you, and as it affects your family and the community around you. The changes that you may notice could be physical changes. So of course, weakness, difficulty with communication, cognitive impacts, as well as personality impacts, and of course how that impacts your relationship from an emotional perspective as well. Brain cancer is different from other cancers, and you probably don't need me to tell you that. I'm sure everyone here had been touched by some sort of cancer before their loved one was diagnosed with a brain tumor. But it's different, and we'll go through some of those details and how things can be a little bit different. But the brain is injured not only from the tumor, but from what we as the medical professionals kind of have to do to try to control the tumor. And we recognize that, and how that can also be impactful for you all in caring for your loved ones as you go through the journey. So for example, the injury, of course, the tumor itself. So here on the far side, there we go. So there's pressure and distortion of the brain itself that can happen as a result of the tumor. There's, of course, the surgeries. We're so fortunate at UCSF to have these incredible surgeons, and within the Bay Area, just all these incredible surgeons. But obviously it's very invasive, and so that can lead to additional insults and injury from the brain that then hopefully a lot of which is recoverable, but not necessarily everything. And then the treatments, the radiation that's administered, of course, the chemotherapy that we're trying to use gets into the brain, right? That's the whole point, is that we're sort of getting into the brain. So that concept of chemo brain and chemo fog, all these things are very tiring. And of course, the consequence of that is potentially even exacerbations of symptoms. So brain tumors in a lot of ways is like real estate. It's location, location, location. And we'll go through today how some things are specific to different areas of the brain, but there really are, everything is very connected. And the more we learn about the brain, the more we learn how connected the brain is. And so there are themes that run across multiple different areas from an anatomy perspective that may resonate with you. So even though it's not necessarily that you have particular, that this tumor is in this location and therefore this is the completely expected symptom, there's a lot of variability. But the tumor location is one of the most key things. The medications, of course, there's the steroids and there's the seizure medicines and there's the chemotherapy medicines that require other medications for side effects. And so those often have an impact on how someone feels and, of course, translates into impact on you as the caregivers as well. And that relates to the treatments. And then the symptoms change over time. And I'm sure everyone in this room has experienced that, whether they're early in this journey or it's been several years from along in their journey. I wanted to take a few moments just to kind of set some orientation. I know at UCSF, I think most of my colleagues at UCSF review the MRI scans with you and so I just kind of want to help as we go through and look at these different slides and try to put the 3D brain into or try to take the images that you may be seeing with your neuro-oncologist and make that into a 3D structure. So here is the classic, whenever you Google brain picture, it's usually oriented in this direction. And this is essentially the sagittal direction. So it's taking the brain, looking from one side, from the right side to the left side, or vice versa. And so when you think about the brain, you can kind of think about it as a loaf of bread. And when we do MRI scans, what the MRI is doing is taking pictures as if the brain was a loaf of bread in slices. So you're just kind of slicing it up and looking at it one slice at a time. And so you can orient that loaf of bread either from bottom to top, which is the axial image here, and this is probably what most of the time your neuro-oncologist shows you. You can also slice the bread, if you slice a loaf of bread from front to back or back to front, and that's this coronal image. So these are the ears. So you're kind of looking at the pictures this way. Or like I said at the beginning, you can do it sagittally, so sort of slice the loaf of bread from one direction to the next. And so I think that may help you as we kind of go through some of this terminology, understanding it and try to then contextualize it when you're looking at either if you have copies of the MRI scans at home, if that's something that interests you, or in reviewing things with your neuro-oncologist. So I'll try to reference this throughout most of the slides that we'll talk about today. So starting kind of big picture, and we'll work our way down. So the hemispheres. So we have a right side and we have a left side. How many people in here are left-handed? Small number of hands. The photographer in the back is also left-handed. The artsy guy in the back, got it. So even most of you who are left-handed and almost all of you who are right-handed, their dominant hemisphere is still your left hemisphere. And when we say by dominant hemisphere, we mean that's where your language sits. And then, of course, the left side of the brain controls the right side of the body and vice versa. And that crosses over, and we'll go through some imagery, but that crosses over in the brainstem and then sort of stays along the same side throughout the spinal cord. But when people here who have tumors in the left side of the brain, it's the right side of their body that's affected. And for most people, that's their dominant side. So it affects their ability to write, and use of their dominant hand. So there's also this kind of concept of sort of left brain people and right brain people. I'm almost certainly a left-brained person, where you have, so again, the temporal lobe is where the language exists, but this is kind of thought to be the analytical side, the practical side of our brain, versus the right side of the brain, which is a bit more abstract and sort of, maybe you lefties who are out there, this resonates with you, as far as being kind of more the artistic and abstract part of the brain. And so I think that is important to understand, because the symptoms that often come from the right side of the brain are often more, it's not that you're having problems finding words or having difficulty with the function of your right hand. These more abstract things. And so some of the management of that and how it affects patients and caregivers can be a bit more difficult to hone in on and then rehabilitate and watch out for as well. So within each side of the brain, then we have 5 different lobes, and we're not necessarily going to go through all of these in detail. For those of you who were here last year, we kind of did a lobe by lobe approach, and what I did this year was sort of try to integrate the common lobes in some of the main functions of the brain. So the frontal lobe is the largest part, so it's the red. This is what makes us different than non-human primates, monkeys. That's my pager, sorry. So that's what allows us to have our personality. It's what makes us who we are. And so just because volume-wise, it isn't uncommon for tumors to have involvement of the frontal lobe because it's the largest part of the brain. And so we'll talk about some of the symptoms that are unique to tumors located in the frontal lobe. Behind the frontal lobe is the parietal lobe. So the frontal lobe also is where motor function works, and we'll talk about that in the next slide. The parietal lobe is kind of here in the back of the brain. That's sensory integration. And when we say sensory integration, that really means all sensation. So the visual pathways go through this, touch and understanding where your body is in space, integrating all of these things together. So the parietal lobe is really very critical. All the lobes of the brain are critical. The temporal lobe on the left side is where the language sits. And the temporal lobe and the frontal lobe are very connected where the function of the face is. And of course, face has an ability for not only being able to form words, so find words and bring out the word, seeing something and knowing what it is, but also putting the speech together in order for the word to be understood. Memory also lives within the temporal lobe as well. The occipital lobe, its main function really is vision, vision, vision. And so when you look at the brain, if you think of this brain and put it in your head, your eyes are here. And this is where the vision is integrated. I don't know who figured that was a good idea, but essentially the vision has to track through your entire brain in order for you to see what it is that you see. And so there's lots of areas of real estate of the brain that can be affected with tumors and injury that have an impact on the vision because it really tracks through the entire brain. So here's the cerebellum. The cerebellum is the little cauliflower-shaped thing that sits at the very back of our brain, and its predominant function is integrating small coordinated movements. So the frontal lobe, its motor function are large movements. The cerebellum is the fine-tuning piece of things. And then the brainstem, which we'll also talk about, which isn't really a lobe, but these are the primitive basic structures: breathing, heart rate control. So everything in your body is controlled by your brain. And so every function within your entire body, to some degree, from bladder control to heart rate to breathing and everything like more complicated, like me standing up here giving you a talk, all is related to the brain. And so again, some of this is localized to different areas, but it's more that it's interconnected. So just talk first about the motor. So if you can all kind of maybe take a moment and remember the first time that you thought maybe something was wrong. And often, sometimes that's headache, sometimes it's a seizure out of nowhere, but sometimes it's something that's noticing numbness or weakness or difficulty with balance or something that projects over a bit of a longer period of time. And a lot of that is related to the integration of the motor function within the brain. So this is the homunculus. And so this is that coronal image we talked about. So taking this, slicing up the brain from the front to the back. And if you focus in on this sort of one area, every time I do a talk like this, it just absolutely blows my mind, the brain. It's incredible. But the way that the brain is laid out in all of us is that the function of the leg is really very close in the middle, very much in the middle of the brain. And as you stretch out, so that's here, so you stretch out, then the arm and the hand become are where the motor function is more laterally. The hand is huge in the brain. So it takes, your hand is so complicated and there's so many muscles and nerves involved in the hand that is spread out over a large area of the brain. And so it's pretty common for there to be, whether it's the tumors on the left side and affecting the right hand or vice versa, that it's not uncommon for there to be some dexterity problems with that hand just because it's represented over such a large area. And then as you come down farther, then you have the face. So the activity of the lips, of moving the mouth, and also of inside, the tongue, and then all of that gets funneled down. So this is this, right? And you can think of the brain as a funnel. So it all comes together in the white matter tracts that integrate sort of deeper down in the brain, and then it follows, tracks down even farther through the brainstem, and then crosses over the base of the brainstem to the other side. So just to say that tumors that are deeper in the brain can really have an impact. If all of this integrates down closely, you don't need necessarily to have something that large to have a big impact on the function of the face and the hand and the arm, as it sort of comes down. So, and then this connects with the tracts from that little cauliflower piece in the back, the cerebellum, to make big gross movements more fine motor movements. So it's something that is that can be commonly affected sort of at any point along the trajectory, some sort of impact of motor function. So just a brief word on the brainstem. We won't spend too much time. This is like the most complicated part of the brain. And the brainstem, everything runs through the brainstem. So again, the brain funnels down, and the brainstem is like the size of two of my finger. It's really tiny. So having tumors that are located within that brainstem is really difficult and can have a wide variety of impact. So again, swallowing is controlled in a lot of ways through the brainstem, and that's the green area down here, the brainstem. So this is, again, that sagittal view. So all of this out here is that, sort of the other view of that homunculus, and it comes down and tracks down all the way. Control of the movements of the eyes are regulated by the brainstem. Also additional fine movements of the tongue, taste, hearing. There's just a large variety of things that can be integrated. And so things to know if your doctor has told you that there are brainstem involvement or that there's sort of motor involvement, as is in the prior image, things to be prepared for are difficulty with mobility. And for those of you who've had either complications, seizures or strokes or things like that with the tumor, and things transiently get worse, that's sort of an opportunity to recognize getting physical therapy involved, getting your house. You're thinking about how your house is laid out, and so that to minimize if there were to be a quick change down the road, how can you be prepared for that? To try to minimize some of those injuries. Wheelchairs may be needed. And then, of course, this is very difficult for your patient, for your loved one, if you have motor involvement, because it involves, and they may not be able to do the things that they've always enjoyed doing, hiking, biking, swimming. They don't have the motor control to be able to do that, and that may have been a very important piece of their quality of life. And how do you that may be something that you all did together, and how to kind of find ways to fill that space if safely. So here's the vision again. So this is reversed, just so that we can kind of keep track of this. This is again a sagittal view with the eyes being here, and the vision tracking all the way and being synthesized and integrated in the back of the brain, and then being projected all the way forward in order for you to recognize what it is that you're seeing. So really, tumors along multiple different parts of the brain have an impact on the tract. And it's not just I said the brainstem's the most complicated piece of the brain. Maybe it's the eye. I mean, there's whole types of species of doctors who are ophthalmologists who just focus in on the eye. I mean, it's an entire group of doctors, and so integrating vision can be very complicated, and it's often true that your loved one may or may not recognize the vision difficulties. It may be that focusing for a long period of time causes strain and headaches. It may be that they don't recognize things very well on part of the part of their world. It may cause weird hallucination types of things. It can cause visual sparks and sort of disruption of the vision. And so there's a lot of pieces of this that can have have an impact. And some of these things are exacerbated by stimuli. So being in a very high stimulating environment, like grocery store, for example, and having to integrate all of that information together. And then this is just sort of a different representation. So the vision that we see out of the right side of our vision is actually integrated across our brain to the left side of our brain, and vice versa. So just emphasizing how complicated the vision tracking system is. So language and communication. So this also spans the entire course of the brain. So if you look at the blue area here, so forming words and your vocabulary, if you will, the inflection, whether you end a statement with an upflexion indicating a question or something along those lines, that's all things that we learn as we develop as children and sort of form connections within the frontal lobes of our brain. So that's this blue area here. So that's very tightly connected then to the motor function, if you remember that homunculus, the function of our mouth and being able to say the words and integrating all that information together. And then the sort of the syntax or not the syntax necessarily, but the actual, like the bank that you have, both understanding and saying your words are really integrated within the temporal lobe. Hearing the words coming through lives in a different part of the brain as seeing the words. And then that also is related to writing down the words. So all of these things are different, but very much integrated. So just to say that communication, particularly on the left side of the brain, for most of us and for most of your loved ones, is really something that can be vastly impacted. So, and then visual, spatial, and sensory integration. So this is that parietal lobe picture that I had alluded to previously. So this is the frontal lobe, the temporal lobe, occipital, the cerebellum, and then this is the parietal lobe. So there's a similar homunculus that lives on the parietal lobe that integrates all the sensation. So the sensation of the leg is on the inside, and then the arm and the hand, and then the face on the outside. So all of that is kind of put together, and then all of that sensory input is integrated in the parietal lobes. Math, in a lot of ways, lives in the parietal lobes. Orientation in space, being able to get dressed, being able to navigate a car or even your house, being able to understand you conceptualizing what's on your plate and what it is that you're going to eat. All of these things are things that are integrated within the parietal lobe. And so there's this concept called neglect. The vision also passes through the vision is also integrated in the parietal lobe as well. So again, it's really a relay station for so many different things. And so neglect is this concept of not being able to appreciate the things that are in your world on one side of your world. And it's a really difficult concept. I was taught in, I think this example was given to me during neurology residency, and I think it was really very helpful. So they sort of figured this out in Italy. Probably somebody figured it out before that. But what this neurologist asked a patient who had a stroke, but again, similarly, acute injury to the brain, to walk to the piazza in Milan. So this is a man who had grown up and lived his entire life in Milan. And as is true for most, has anyone been to Milan? No. Yeah. Okay. Okay. Phew. But a place that is really well known, where all the shops around the whole piazza would be something that he would have memorized, and just like your neighborhood, right? And at one end is a cathedral. So the neurologist asked the man who had a stroke in the parietal lobe to close his eyes and walk up to the front of the piazza and to the steps of the cathedral and look out on the piazza and to name everything that he could see. And so he could name everything along the right side up until the very middle, and then he stopped and he couldn't name anything else. And the neurologist said, okay, so now what I want you to do in your mind is walk down the steps of the cathedral, walk to the other end of the piazza and turn around, look at the cathedral and tell me now what you see. And of course he could name everything on the left side. So often people perceive this as truly vision. It's a vision impairment. It's not. It's more than that. It's full integration, right? It's this guy not being able to to shave that side of his, not realizing he needed to shave half of his face, not recognizing that he hadn't shaved half of his face, only being able to put clock numbers down or recognizing sort of half of the space. This also can be an auditory, so not hearing things as well on the left side or the right side, depending on which side of the brain is affected, putting makeup on only one side of the face. These are all sort of interesting things. And this in practicality is something that's often seen with getting dressed. So just not being able to button your buttons and put things on inside out, all of those things. And so from a caregiver perspective, that often requires a lot of additional help. I mean, tying your shoes, and it's really, right? It takes us years to figure out how to tie our shoes when we're children. And so these are things to kind of contemplate. So this is a really difficult concept, but it's also really important. So just to kind of run through a bit of a case. So this is a 28-year-old right-handed woman, so left brain dominant, who presented in December 2019 with a seizure at night. So her spouse realized something was wrong in the middle of the night and called 911. And in hindsight, as is, I'm sure you all have, if it was something sudden like this, like a headache over a few days or a seizure, you rack your brain for days and days in advance, trying to remember if there was something subtle that would have pointed that something was wrong. And a lot of times there isn't. Everything has been, it was sudden, things were sudden, or they were more abstract, more tiredness, maybe a funny smell, as was the case for this patient, or just having a hard time concentrating. And her MRI demonstrated a mass in the right frontal and temporal lobe, sort of a junction between those two areas, which combined make up the bulk of of everyone's brain volume. So she underwent surgery, and the biopsy results or the pathology results demonstrated a low-grade tumor. The surgery was in an area where it could be completely removed. And the plan was not to, because it was a low-grade tumor, the plan was not to do any additional treatment at that time. So no plan for radiation or chemotherapy, and just to observe with scans. So on follow-up, she did notice, even though the surgery had gone very well, she had noted difficulty with short-term memory and some problems with slowing. She had some neuropsychological testing, and it was tested to have some difficulty with attention and this impairment in visuospatial skills. Some hard time recognizing something that should be familiar, recognizing emotions of other people's face, and then being able to respond appropriately, and difficulty with sequencing. So being able to make a grocery list or cook, things that kind of take a lot of thought process, putting things sort of one after another. She slowly improved over the months and year or so after her surgery and was able to get back to work. So just to kind of, again, talk a little bit about some of the specific functions. So again, the frontal lobe is who we are. It's our executive function. It's our integration of organizing, keeping attention, listening to what's happening on NPR while putting the dishes away and keeping an eye on what's in the oven, putting all of those things, listening to music while driving a car or having a conversation, while washing the dishes or watching a TV show, sort of putting all those things together. The frontal lobe really does a lot of that, anticipating things. It's our personality. It's what makes us who we are. It gives us our filter, if you will, knowing, as we get older, not to say inappropriate things that we may think in a public space. Being able to be motivated, getting up here this morning, knowing it's gonna hopefully not, but possibly rain, and that your drive home may be sort of taxing. But a day certainly worth coming to. But all that motivation is a part of the frontal lobes, and then the emotion component to things as well as the motor and speech that we talked about. And then the temporal lobes, again, is integrating a lot of that information, understanding, finding words, hearing words, putting it all together, reading and writing, and remembering it. That all lives within the temporal lobe as well. So again, this person had a right hemispheric tumor, and so the things that were noted is some personality changes. People who have tumors within the frontal lobe can have some changes in their personality because, again, this is the lobe that affects where we are. So they can have some apathy. So it's difficult to get motivated. It's difficult to get to the doctor's appointment. It's difficult to get up early to get to that 7:30 MRI scan in San Francisco. And it takes longer in order to be able to get ready. It can have an impact on altered empathy. So again, not being able to read faces or read emotions and respond appropriately. And especially in the right hemisphere, can be often a lack of insight to this. So they don't know that they're not, that they have this difficulty with motivation, et cetera, that it's actually, they think everything is fine. And you as the caregiver often recognize that it's not, but it's hard to convince them of that, like almost like a child sometimes. They have difficulty with sort of mental flexibility, so being able to accommodate, right? Like your GPS tells you to go this way in order to get around an accident, and having that same sort of concept within rote behavior, being able to make sort of changes on the fly, so behaviors may become a bit obsessive and routinized. And then again, ability to read facial emotions, and then difficulty with short-term impairment, right? I'm sure you've all had the experience probably, or many of you, of having a conversation over and over, and you feel like, why didn't you hear me the first 5 times that I told you that you have your doctor's appointment tomorrow? And then they say, well, when's my next doctor's appointment? Having that conversation, and that's frustrating. It's very frustrating. So again, just to kind of go back to our case, so again, this is what we'd already talked about, so slowly improving and getting back to work, but over time that the spouse reports just behavioral changes and some difficulty with motivation and apathy. And so, and the patient perceives that as feeling disconnected and irritable. And so again, I think this is an example that maybe some of you in the room are in, where your loved one has a low-grade tumor and the doctor did surgery and you were told everything was good and the plan is just to monitor, and things aren't the same after the surgery. Things can get close to back to where they were, or even if you're in a situation where you have had a lot of treatment, radiation, chemotherapy, but maybe you've been told that things are stable and everything is going really well, but still things are just not at home. Things continue to fluctuate and be different. And so considerations for a lot of this, we now have a neuropsychologist who's both part of the caregiver team here and as well as the sort of brain tumor center as a whole, who can really do a good job of a lot of education. Fatigue and management of fatigue can be really helpful in sort of putting all of these abstract concepts that are sometimes on the right side, but also can often impact the left side of the brain, and trying to manage that over time. So consideration can be given to neuropsychology, and then also consideration for psychiatry. And I think all of the injury that we talked about at the beginning of this talk is also chemical injury. It's disrupting not only anatomy and structure, but it's the integration, it's the neurochemicals, and that's what affects our mood. So these things can also be dysregulated when you're going through this process, and trying to rebalance that can be important. So what do these things mean for you as the caregiver? Well, this patient who had a right-sided tumor, who had a very good surgery, was able to get back to work, and yet and so the expectation from that family and the community of that patient may be that everything should be back to normal, that they don't seem sick anymore. And some of you may have loved ones who don't have weakness on one side and who are walking around fine, and so people are like, well, what's wrong with that person? Because they seem like they're doing fine. They don't seem sick. And of course, that's not true. So some of these symptoms can be invisible symptoms. So focusing, paying attention, going to the grocery store and making change for the person who, the cashier, and of course the cashier not realizing why is it so hard for them to make change. So putting a plan together, organizing a big trip, all of these things are things that can be different and less obvious. And of course, then the circumstances of the patient lacking the insight. So warning signs. So what can you look for? I thought this was kind of funny, just for a little bit of humor, like aliens, a unicorn warning sign. I thought a dragon warning sign for those of us who are watching Game of Thrones. What are some of those triggers? What are some of those things that you start to recognize where things get a bit more complicated, where the person that you love gets frustrated or gets overwhelmed, and then that brings out other symptoms. So noticing when some of these things escalate, diarying and journaling about what are the triggers that seem to have that impact, And sometimes what that can do, what needs to be done is changing some of the expectations, keeping tasks and assignments short and small. A lot of this is not your loved one's fault, not being able to remember things, but at the same time, it's certainly still frustrating to feel like you've had this person who you've been able to give a list and go to the grocery store for decades maybe, and they can't do that anymore. So changing your expectations, it's still setting them up for success, and then realizing when maybe you've given them too much, for example, and having that recognition and backing off in subsequent examples. And then just providing more structure and organization, so keeping things a bit more regimented and putting sort of that infrastructure in place so that they can understand the expectation of every day and the routine for every day. And then symptoms definitely can change over time. So the symptoms that were first remembered from a few minutes ago, that first event, those symptoms could be different after surgery or radiation, and they could be different, months and years thereafter. So it requires a lot of flexibility on your part to change as things adapt over time. And again, just to say that everything is very connected. These are some of the examples that we talked about today, the motor, language, vision, and integrating all of that. And just this is a connectome as we get, you hear at UCSF and across the world, as we get better and better with looking at things with MRI scans, things that are in the frontal lobe are connected to things all over the brain. And so it may not be that you have a patient who has a right frontal tumor, but that you recognize some of these symptoms, and that's because this is really more connected than it is separate. And some of the things that we can't localize very well to the brain, but really are more abstract across the whole brain. So common symptoms that are unifying across all different types of brain tumor patients or personality. So again, that apathy, abulia, the impulsivity and judgment, being able to keep that filter in check and know when to act, being motivated to get up and do the dishes or clear the table, but also not jumping up and doing it too quickly before everyone's finished, for example. Cognition. So cognition is also something that really is broad and affects a ton of different parts throughout the entire brain. So all of these things can have the impact of just things being slower and just the process not happening as quickly as it always had in the past, and how that relates to mood and attention. And then as you're making these big decisions with your loved one, communicating about treatments, this neuro-oncology is complicated, I will have to say, and the brain is complicated, and we're trying to have you and your patient participate in these really complex decisions. And so it can be really taxing. It can be really taxing. And then that piece of you having to communicate whatever that decision is to that bigger community as a whole who's interested and, of course, has your loved one in their thoughts. And then sleep. So sleep and fatigue affect absolutely everything. Sleep is detox for your brain. It's dialysis for your brain. It's true for all of us in this room. Sleep is important for you. So the sleep and fatigue affect everything, not just for your patient, but for you as well. And so that's why it's coming today and setting aside some time to take care of yourself is not selfish. It's important for you to help to take care of your loved one. So it's critically important. And again, lives throughout your entire brain. So every time, I'm sure you've already noticed with the patient, with your loved one, that when they're tired, that all of the symptoms are worse. And so doing the best you can to anticipate that and help keep structured sleep time. And so strategies, and Margaretta's going to spend a lot more time talking about this. So acknowledging that mood and behavioral changes may be related to all of this injury, not just the tumor, but the surgery, the radiation, and all of the treatments. And so the not remembering the grocery list or not wanting to get up and go to the doctor's appointment is not intentional. It's injury. It's a result of their tumor itself. And then what are sort of the triggers that escalate these things? Angry outbursts, being forgetful, not helping around the house. This sort of rotary OCD type behavior, needing longer time to read a book or trying to balance a checkbook or something along those lines. And recognizing that there's just more time and flexibility is going to be needed. What time of day or there's early birds and night owls, just like they've always been, and trying to balance that within reason. And then this lack of awareness. So not only is it not intentional, but the patient doesn't necessarily realize that they're doing these things. Importance of sleep and fatigue, and keeping certain circumstances. If going to the grocery store overwhelms your loved one, then don't take them to the grocery store, or really go for just a few minutes, because all of that stimuli exacerbates all these other things. So again, sort of a negative feedback loop. And then over time, needing to provide more structure, a lot more planning and infrastructure in place than maybe your flexible lives had been previous to the illness. So with that, I'm going to turn it over to Margareta, and we have some time, I think, at the end to answer some questions that you might have as well. So again, thank you all so much for being here. I see a lot of familiar faces. If you have questions, let us know, and thank you for your attention.